Hi, welcome everybody. Today we have done the free webinar on the scientifically proven Chinese herbal formula Protectival. And one of the creators, because he has a whole team of course working behind the scenes on this product many years ago. How long ago was it?
About 20 years actually.
20 years ago. Wow.
Research always takes long.
Yeah, of course. And especially when it has to be scientifically proven. Yeah, it takes a long time of course. But the webinar we just did proved that many people are with questions about the usage in dosage, on which kind of cancers it can be used on, and the experiences you have, the ingredients. So we would like to go a little bit more in depth and do this interview with you. So one of the main questions is how to approach a patient that comes with the question, I'm doing chemotherapy currently and my immune system is getting very bad. I have fatigue, a lot of symptoms that make me lose the quality of life actually. Can you help? What is the moment to start with Protectival?
Again, always the best is to start before. Before you actually starting chemotherapy, to maintain your immune system.
Yes.
So if possible, if someone knows in advance or knows as far as meeting the practitioner before his chemo, even before surgery or radiation or any other intervention, it's good to start before. A lot of people actually come when they have already the side effects. So it's okay to start later on, but it's easier to maintain immune system rather than bring it up or modify it.
Yeah. And what about the dosage when you are not under chemo yet and you have been diagnosed, let's say with breast cancer, for example, and you're 35-year-old woman, and well, you have been diagnosed, and the question is, I would like to use Protectival, but what kind of dosage should I use?
Again, it will be always good to start with the full dose.
Okay.
Full dose is it's not capsules, it's two tablets 3 times a day. And also in our research, this was the amount that we use, and from the beginning. So it doesn't matter if you've been diagnosed now, you're waiting for your final findings. Just start with the full dose and take it all along the chemo. If someone is after the chemo, they only start it now. Again, we'll start with the full dose for at least a few months to build your immune system, and then you go to maintenance dose, which is 3 tablets a day.
And the maintenance dose, can you continue, for example, for 5 years?
Yeah, actually I recommend for people. Yeah. I must tell you, I'm taking herbal medicine. Herbal medicine has been shown to improve vitality, to improve your immune system and your general health. So obviously someone who had cancer, who has been exposed to chemotherapy, should take something to strengthen you, to potentially prevent the recurrence of disease. But usually 5 years is a good timing to look at prevention of recurrence, and I would advise people to take all along.
And one of the questions we had today in the webinar, I think, was a good question, if you don't have the knowledge you have, about the renal function. A lot of people fear sometimes to use herbs, and they have read something about, well, it can affect renal function. How can you inform them about the usage of Protectival?
Okay, we have to differentiate 2 people. Yes. Normal people with normal renal function.
Yes.
Our research has proved safety. This is the whole idea behind research. You give to people, you compare, they're in a hospital setup, their renal function, liver function are checked regularly. In my clinic, I've seen hundreds of patients taking Protectival. We haven't encountered with any problem, renal or liver problem. So that's for normal patients, or normal people with normal liver and kidney function. Obviously, if someone has some disease or impaired liver or kidney function, they should be monitored very closely by the physician. They can take Protectival with a very close monitoring, and obviously then the involvement is different than the normal person.
And And if somebody would have been advised to take, let's say, in the case of lung cancer, some kind of medical mushroom, the cordyceps, for example, that you hear a lot about, would you recommend that, or what's your opinion about this?
Personally, I'm coming from a traditional Chinese medical perspective, which means humans are complex. And as a complex, you want to use a complex medicine, you want to use formulas. Chinese medicine hardly use one herb, because one herb enhances the other one. All together, they work like a team. It's like if you have a problem, you can have one person solve it, or you can have a team working on the problem. A team, especially if you want to run something much more bigger, a team will do better work than one person. So we hardly use a single herb. And so to me, to give one product or one herb is usually a less good approach than taking a formula, and especially scientifically validated formula, which shows safety and shows efficacy.
Yes. And when you look at the formula, it is like how formulas in Chinese medicine are based, and we have lever resistance, etc. Have you been in those 20 years adjusting a lot the amounts, the positions of the herbs? How did that go along?
Before we started the research, we we had clinical experience of different adjustments of formula, and we came up with a formula that somehow has a very wide application. And the more we are researching it, the more we are seeing these results. Yeah. So I feel very comfortable with the way we adjusted it.
Yeah, I of course heard you say in the seminar, the webinar we just did, how the research is based on not only the 20 years, but it is the thousands of years of experience, of course, with the herbs that are in the formula together. And then we have questions about different kinds of cancer. You have had this research done on the breast cancer case study for 5 years. Any other particular studies you would like to mention or point out that are very important for viewers to know?
Well, at the moment we have, as I say, 20 years of research with different collaboration with different groups, and definitely we've shown the protection of side effects of chemotherapy, and we've researched many cell lines, many lines of many types of cancers, only solid cancers. Yeah. So we researched breast, colon, lung, prostate cancer. We have some lines of pancreatic cancers and others. And it is consistent in its anti-cancer effect in vitro. So, as I said, we mainly concentrated on solid cancers as far as the anti-cancer effect, and the results we've definitely seen was also immunological, and was not just immunological results, but also because of the nature of the herbs. We see the adaptogenic nature of the herbs, so we see actually immunomodulation, which means it's really, even if there is a tendency for inflammation, it reduces it, or if there's overactive immune system, it reduces it. If there's underactive, it enhances it. And we showed it on many different immunological models. So seeing a formula which has immunological effect, anti-cancer and protective, is quite unusual, and this is the nature of combining herbs. And that's why I'm so much advocating something which is totally opposite to modern medicine. It's exactly 180% to a molecule. In a formula, a lot of molecules, but they work together. They've been working in nature for millions of years. The plants have a reason, they have their own wisdom why they produce different chemicals or biological activities in them. It's also to protect them from nature damage, and that's how they sustain. So we can use this wisdom in nature and the wisdom of Chinese medicine to point out to the certain plants that have the best ability, and to point out to how to combine them together for the benefit of health, not just cancer, but general health. So I think this is the territory we are discussing. We move from the territory of molecules, into a territory of wisdom of nature and how to combine this wisdom to support our health and prevent disease.
Yeah. To go a little bit further on the other developments in your center, there is this Protectonic arm. How does that relate to Protectival? Can you use it together? How would you advise on that?
So first of all, I must say I'm really lucky to work in a large medical center that has both like preclinical facility, that has laboratory, and has clinical facility. It's quite unusual. So what we do now actually is a different product from Protectival, although 5 of the herbs are the same, but there is additional herbs, and the called tonics are, and it's focused more on the immune system and white blood cells increase. To most patients, especially when they're undergoing chemo, I can combine it. But it can be also for healthy people. If they are, in our research now, we are taking blood out of healthy people, cancer patient before chemo, after chemo, and we are looking how the herbs are affecting ex vivo, means on the patient, the person's blood, how it is activating his own T cells and natural killer cells. The results are very consistent with all the people we are checking. Hope we'll publish it soon, and it shows again enhancement and increase of activity of immune system. So it's a formula, it's a smaller formula, 7 herbs, and it's more Qi tonic in Chinese medicine, but it tonifies Qi on 3 levels. On Wei Qi, which means immunity, of Zhang Fu Qi, which means protecting your internal organ, and on Jing Qi, which means working like on the level of bone marrow and deeper on the production of the body's basic energy and vitality. So
for example, this could be a very good formula for people with Epstein-Barr virus or with autoimmune problems.
Just if you are tired, or if you are like, been flying all the time, or you know, it really enhances your immune system and it gives you more vitality. As I say, most of the herbs are also in the Protectival. The Protectival is larger and is more different direction, and this one is more white blood cells and increasing immunity in Qi, without actually warming, so it's also important. So everybody can take it even if they have other problems.
Well, what are the future plans?
Oh my God, there's so many future plans. I must say that the future plans all are coming under one vision. How to make Chinese medicine part of regular medicine and part and available to every patient. I'm concentrating now on cancer and cancer patients. So all our future plans is to design more human research. I call it heroic research, so the results cannot be argued, and showing that herbal medicine together, usually with normal medicine, has advantage both in quality of life. Hopefully will also show that in prevention of recurrence of disease and mainly in curing from cancer.
And what extra advice could you give our viewers in case of cancer, besides the uses of Protectival, to do in lifestyle changes?
We usually advise people to look at 3 or 4 different modalities in the same time. So obviously one modality is Western medicine, another one is herbal medicine. Also to look into their diet, to look into their body-mind, to use different techniques to enhance their ability to cope with the disease and to bring back peace of mind, and physical activity as well. So the more you combine different modalities, it's called a multimodality approach, I think the better you cope.
In the Shiva Center, do they also use like foot reflexology when there's nausea during?
Although for nausea specifically we use acupuncture, we use pericardium 6, embedded needle, we leave it there, we even treat the cancer patient during their chemo.
Very good. Well, I would like to thank you again for this interview as well, and well, I hope this gives some extra information and gives you a good idea about the usage of Protectival and of course Tonic R. And Dr. Yair, thank you very much for today. We had a great day, I think.
Yeah, thank you, Petra. Thank you very much.
Okay, on behalf of the Naturopathek and Dr. Yair Maimon, I would like to say thank you.